Masaulo Mr. Anastasio Seng Lungu, Mr. President, tawir ako mamay galom skawe. Di mo ay sarbelulo sa tuwata o bangga ng artel press conference. Mo bangga al itasil sa artel tukubat sa press conference ang ani at nga kal President Rablur Belaw Surang Whipps Jr. Madirek Vice President Minister of Justice at nga kal Chay Udo Senior. Madirek kal Minister sa nga niya Minister Public Infrastructure and Industries at nga kal Charles ER Obiang, Madirek kal Minister of Finance at nga kal Kaileb Udoy Jr. Minister HRCTD at nga kal Ngiray Velas Matul, Minister Agriculture, Fisheries and Environment at nga kal Stephen Victor. Direk labang ganda nga press conference afternoon na Miss Riter Udoy, may incidents commander EOC, Mr. Kafaru Erbelaw niya Deputy Incidents Commander EOC. Direkal nga niya Dr. Ten Henkakal niya Medical Epidemiologist, Center for Disease Control and Prevention. Direkal Dr. Haley Kias niya NCD Regional Epidemiologist for SAPI Pacific Island Health Officers Association. Dr. Victor Emiano niya Public Health Advisor EOC. Miss Landisang Kotarol niya Chief of Staff kay President. Tigay idir below o bangga nga press conference afternoon. Mga ulgyong sa President mo kung afternoon. Nga niya karira at media mo loger auril. TOI sila si tilmutulo lingit sila si confine na question ni di mo atora COVID-19. Nga niya ito ko please mailmir ang rule mo draw and stay. Vice President ako yung muska mo makmul da dami afternoon.
Mal sulang Edward dara nu ko tulo mal nungilite asils moray budul maraklay marubul belaw bilong ebiraklay marmasil belaw President Senate marugul senators Speaker Anastasio marugul delegates governors legislators ministers adala Ministry of Health Incident Commander Udoy, Mr. Erbelaw, Dr. Hancock, Dr. Cash, and Dr. Yano. Susirgid mar other belaw rogul ngara lodeng sirgid al sils. Ngara ayangan mor hotchari mga rekla blur belaw. Tuta mnari ko yigel bekal mandem blo ngara a worshiper obviously sirgid rangarul muth. And you know one of the topic ng pastor dyan na sa dara Moses mga Israel. Yan nga Israel tobo dara Egypt and dimlakal stobel complain Dr. Yano. No mara ngaral albangalir niya dimrala munday. Di kita madina sengari munday ngari adakt. Mal understand thersel sebak rengar adrablu. Mung cloud to trela adabera abway ekman mereng asule la medial tial special press conference el mas ilang artiam lang cloud to trela igel maral information al blaktak mar adrablu malakal klo around ngotrule igil amlom dinger sera ongi mulurior el wase ngari aterul adal marsel flight tra kwamel may el selera tel nombre kal Sunday amle positive le katumlar sel 5-day test kadam tigatir kadam milir agel verification masel midnight ra a Friday igada no isra blue lo kadam la verify through an antigen and a PCR test was moral positive iga imported cases il tablo diregal over the weekend other EOC Ministry of Health sel dom godoria saying contact tracing aulumul mungulmul trigger rogul blal contact tracer tir lui matewalad blodo dingel wase te negative rogul diaga tartir el positive te dimle negative rogul podelo aseng botoka information amrana blu ndi gida correct information so we'll make sure adra blue aklawadaran did was say there's no other cases at this time. Maldigay the imported case. Di selungil ay sir siya tiagid. Ako truul, trigat terul cases. Amlera mura blur belao lera Guam flight, meaning they're required to be vaccinated. So tamle vaccinated, and they were asymptomatic. That means dimla ka ngidil part dimla ka ngaral filengi malubang gora araktel el causatir mong wala siyang marina apterir ngaray I get symptoms sa COVID dimla. Uli ka daw namdaya sa toba COVID, kidam le tested kir. Makatulog ka naman sa vaksina ang ilo urior lula adamong hindi kalsan mosmer. Malubang hindi kalfil raser. Ya, ang erong kadang sa testing system rigid urior. Yung kadang mo emertir. So ang action hospital beside the contact tracing, trigel terul el possible trigel el test positive am sibro hospital ngarsel trigel igida direl el mlasker trigel leda contact tracer tilo sa mga quarantine direl trigel tbsay. Gida of course ang so del qotruul ang so del selbakra adrablu mulakalo pre-direct mong ayaya precautions sa blal rule malabaya oral blarula Ministry of Health rigid mal mereng asulia staff ra Ministry of Health and Human Services mal nemring oral al weekend algot moklay gay gidan rogon ngara alnya amaklo tutelan elal silse ngariar sa lidal ngartiang sera Friday mlenate level el modo dura doctor Hancock via Zoom. Seguido el time que damos lo torga clil va a ser un cloud tutelel ada drut lo mesa yel uk tertera testing rida tiblo ngasa ek kada tilbil va a ser trigel mlera sus amo testrel al tutau malas mal morsel va a ser kada tester tir airport sel leger le adar ngaram rigel me 72 hours el test imu masas kogi so mal ngodo seluk system rigidra Taiwan al tangar airport test ru nga sa askogi mong ndiak seguida la simno sa temor norger meger test sel nga sa askogi tial ukka kwama nga 72 hours ru e mong neurtur seguida ma recommendation ma seguida makalaurer ase rugo increase seguida testing seguida el meeting adregal noria tele de modo adram rigel modo mal merenga sula adram rigel ambassador amrigel Ambassador Hennessy Island. And no sabi laureol tira adra CDC. Maula Dr. Henkaga ma Dr. Cash amo si il merbelara kasus. Yang artiale rule Sunday. Lolo sera gider rogui artia gider el pandemic. Ma igel uldas wase ngarai igel ungil el tretar aureol dol tirakle era adra berasel ba. Kada mring asule la government trambrigel matrigal terur tohtan uknos il join together al seeds. I'm going to speak in English because I was told that last press conference there was no opportunity for the English speakers to know what was said. But first of all, we had on Friday evening, 2 of the passengers that arrived on the Guam flight tested positive on an antigen test. After that, Ministry of Health protocols are to do additional tests with PCR to verify if they are correct. At midnight on Friday night, it was determined that they were verified that the 2 cases are imported cases and they were positive. Immediately, earlier in the evening, the 2 cases were brought to the hospital. They were put into isolation and have remained in isolation. They will be in isolation for 10 days. Their contacts have been contacted, have been tested, and found to all be negative. 24 contacts have been contacted and tested negative. We appreciate all the efforts over the weekend for the EOC and the Ministry of Health and Human Services staff in testing and contact tracing and getting all this work done over the weekend to make sure that we're protected. During our phone call on Friday night with Dr. Hancock, we discussed measures that we need to take maybe to enhance our protection. And I think one of the things that was determined early on was adding an extra level of testing. So all passengers that were coming in on the previous week were only tested on day 5. Now, on this flight that just arrived last night, the passengers were tested this morning, so the day after. And we're hoping in the future that we will test them at the airport upon arrival. That's the next level. We just have to get the logistics worked out at the airport, but that's the plan. On Friday evening, we also had an opportunity to contact Ambassador Hennessy Neeland and let him know of the situation and our request for help, for experts to come and help us, to guide us and give us good advice on how to best mitigate against the challenges with the COVID and the Delta variant. So at that time, our request went to the U.S. Ambassador. He worked with CDC, and on Saturday morning, he let us know that Dr. Hancock and Dr. Cash would be coming to Palau for 2 weeks to help us through this process and give us advice, best practices, and you know, just help us understand COVID better. And so we really appreciate the assistance of the U.S. government and for the 2 doctors to be here with us today. We just came from a meeting with Palau's leadership and had the opportunity for open question and answers. And I think this afternoon our goal is to be able to discuss with the media openly questions about the people's concerns in the public, especially on should schools be open, should we continue life as normal. Those are things that we want to discuss and make it clear what our direction is. So a simple answer is yes, schools stay open. Everything stays as normal. We should follow those best practices like wearing a mask, washing our hands, social distancing. Those are good things to do. Doesn't matter what kind of variant you have, those are good things to do to help prevent the spread of COVID and keep us safe. But most importantly, get vaccinated if you haven't. Maloise, ibay kung telteal المسا كفار مبول بس كده update الجيرة لا تيال الكوفيد هذيك ترى تريال من الدين رجيد ملا بلور أمريكا لا help رجيد لو مس كده otherwise يدير القرا أو نسير رجيد لا يجل كوني لورو لا يجل بيبي رابلو الأسئل help الشباب كده تيال تقرا كوفيد يدير القرا يسجل راسه مرا يجل cultura hakase ngara igel lungil dol tirak teletar aurul gida amrur osabak ter adar bela o ise de poktu yegi de kulni traga farm bol biskida update sulang
Mr. President malungil tasil sa marabeklat aktin mo to kamo do ela bebira details ra igel tablol case again hindi ka last time hindi ka tu Madingil lasing ngariya tokol ay silmarara social media lo setam lamot tewang em lamot telol me te with ten so sa mga clear sa at time mandir gat tigil tablol case tamalmol mga isolation kung nasa namo sa edalo ay so set tirka other belaw mlara merigel el may nasa igid el flight imol dadil ma imol saal ta malmutal at time and ta asymptomatic bulgulak mundia ka kora ulang alelarak dan ngerti infected emal mol ngara isolation hospital sa idil dila president 10 days president tamlo dula o 24 initially mlaringa 24 close contact sa tirgay del positive case el mildang eli melang arian muteteru till 26 am la test negative mutel me test ra day 3 ma day 10 So, na-issue tira quarantine order. At mutul mo test tira day 3, ma day 10. Tirigel terul positive case, ngara isolation 10 days, at test tira day 10. Kaya close contact abulgulak more other surveillance sa Ministry of Health and Human Services sa milingit mokra investigation al interview tikal positive case loger tirap tokol batangila ager luldimuk ringi ager lo se kom larger tawat al ada misal kora man lukme tiril within 6 feet kasingilang at least 15 minutes hanggang kakaru sa criteria al ada mo umatang at mong close contact sige damle result sa igid initial contact tracing investigation tigid 26 mga tangat taling so far at negative hindi again malmol naman ni tortir mutul mo test tira day 3 ma aday 10 mong swadal kora din mutul maklat ka adra bulul wasel sugum hindi ka umakadong orkaw ak madingel se kada turkok kal madan tiri kalat tokar adril detail na uay sama kada malasamel mga lakran ng diyan adra bulul wasel sugum diri ka kamwa adeng water other hospital wasel ka loam lek med tigalat ing ahmal ka kadete le close contact tin hindi swadalo uay sa adra bulul wasel urior amalmol hindi ka dilbor se stop kada malmol lo mesa ra situation malmol mga mokra contact tracing at sugum diri nganiar made el adal el tira amlok med tigal positive case direct kal swadal المقطع التقرا تيستينج بتوقع question الجيرلا تيجي الدلتا فاريانت من صار المقطع كيلو سجل تيست اللو لابر الالتايم را اوسبيتال ما كلينيك را دكتور يانو asabel dong ingal raktel ngal armela COVID-19 ngel SARS-CoV-2 virus hindi sel mo malang alwaseng gangaral variant agire dalol durok ra specimen el moralabel ngara ablura marigel Masa direct kal gimot mo kuring lurior gi malas man durok lagel el sample ertigal terul positive case el mamarara adurstel ngarsel APA flight mo tangal tangat lang at yang Dr. Hancock direct kal sabe el korang usugi ter segi del process el durok lagel mora abalura marigel el mora sequencing el mo omesering el sing mal ngaral el variant hindi el time kada madingil lo sing positive case kita mangira result sa igid sequencing direct kal so adalo ay sara adara bulul wase sa igid el plan el bleda announce ringira last press conference el wasing ania mitigation plan el bled endorse ringa NEC sa igid adul tuiringira tokoira community mitigation mong betoka question el girela school magirela siobay ma Aureol waseng malamol malubendia kum tokagel girela amoklol gor ondib ma kamaldil mang swada lo ay sara adra bulu waseng ani segi del plan dirgel endorse ringa NEC el alwi kagi mo ge ko kumamel lo tob dringi o lisakra adra bulu waseng mal ngara bulgul wasel sugo mong lengelak tela el geis al sela bulu mlakad na morang ral stage ya al sugo mong require alaktaw ni ngoy ngrang yegita kora details nga alsel sa igid mitigation plan di close to tlela todo al time asero igel bladu president kadaman mol ngara amrula igel dorul hindi kita di mo korigik bay direct kal soba man uttalte al mal mal sulir adra bulu lengwal di ka meirel top de la sempre como mask igit tel ngar set tel yo mask rogui ada por abevira shoba di film la otobda tigingil lo se o vera ablima mengiri lo mask malung giri makarang kay gidya dobre nga sulir adra balul gireleng wal dilgi del take initiative mga tmok la preventive measures hindi sa gidya dol tirak sa gidya mitigation plan yung wal dia ka a mandate tra Ministry of Health and Human Services at time el mandate anything beyond regel nga ring at time hindi again dia ka tomera shoba el sumguk tingil so al implement tegel sorry implement the preventive measures mong sige da ko tetela lauriol moving forward lo sega da mo omes sige del mitigation plan direct el albla lut el reactivate EOC agi mo gil amol top da daily mutel mo daily cell situation report mandial dil bekkel sunday mo bekkel sil sa el top da ko updates el mara media mar adra bluUnda sige kita ungil updates for now by real mo questions.
Hindi kam summarize ito ramari yan.
So just adding more details to what has been said about the 2 positive cases. So again, we remain with only 2 positive cases right now in Palau. These 2 cases are both Palauan citizens, one male, one female. Both traveled from the U.S. Via Guam on the August 15 flight. And they were tested positive on their day 5 test on August 20. And as the president said, they were confirmed that evening. Initial close contact revealed, contact tracing revealed 24 close contacts to both cases. They have since tested negative, and they're placed under quarantine for 10 days with further testing on day 3 and day 10. Today, there were 2 additional close contacts identified, so they too are mandated the same quarantine orders and will be tested on day 3 and day 10. So far, the 2 positive cases remain asymptomatic. They will remain in isolation at the hospital for 10 days with a test on day 10. Again, we want to reiterate that contact tracing is ongoing. And if you have not received a call from our surveillance team, then there's very little possibility that you are close contact. So we know that there's a lot of concern in the community that people might have seen the positive cases. I'm pretty sure some people already know who they are through their relatives. So again, we have to we ask for cooperation and patience, and let our surveillance team continue with its contact tracing work. Another initiative that we will be looking at and working on this week moving forward is the community mitigation plan for COVID, which was endorsed on Friday, well, I would say Saturday morning by NEC. And that plan really spells out what mitigation measures are required at what stage of infection or community transmission if we come to that. So that's one of the activities that EOC and NEC will be working on this week and next week. I think I also failed to mention the school mitigation plan, which is ongoing work with a work group that includes Ministry of Education and private schools, principals, and Belao Head Start. So we know that the unvaccinated are those under 12. So that plan will start focusing primarily on the kinder to 8th grade, on that age group, and really looking at how we can keep schools open, but at the same time make sure that we put mitigation measures in place to reduce the possibility of COVID transmission if it comes to that point. So those are some of the ongoing activities, and we're thankful that Dr. Thane Hancock and Haley Cash are both here for 2 weeks, and we'll be sure to utilize their expertise and advice when we engage with our partners from the Ministry of Education and others in doing these plans. So that's sort of a work plan moving forward while we continue to monitor the situation with the positive cases. We will also reinstate the daily situation reports to the media and to the public via, we have an email listserv as well as Ministry of Health and Human Services website, and numerous profiles on various social media channels. So we'll disseminate those daily situation report and then press releases as they are issued.
Oh,
Yes, just want to also remind that there is vaccination on Friday at the National Gym Pod. So any remaining 12-year-old and older who have not received the vaccine, please come to the pod on Friday. 2 p.m. to 6 p.m. is operating hours for the pod on Friday. So again, any remaining 12 and older who have not received the COVID-19 vaccine, please come to the National Gym Pod on this Friday, 2 p.m. to 6 p.m.
Rick Octoli Gafal was a tial the face ring al seals. Langaregal tablol positive case is what we've been planning for. Mlamo 18 months ra the sisabra COVID. Gadamral mrenga sula la Ministry of Health and Human Services. Ma team tira gotem le blagarandir el first that masab akari umlemring la quarantine and then umlemring la el vaccinator to get us prepared. Back in March as real misel team HHS at gadamlat magi say ilang giria del masamo crowd the Sweden mom they say namuda kadangara namuda gil dam dasra COVID free kadam dasra COVID safe. Mong Dr. Hancock ira ite ang artikel abangget maybe help artikel discussion ma direct opportunity ra media logera. So I just wanted to say that first of all we've got to be thankful for the tremendous effort by the Ministry of Health and Human Services and the EOC team to keep Palau COVID free for a very long time by implementing quarantine measures that have kept Palau safe. And then launching an aggressive vaccine campaign, which has ended up being the most successful vaccination campaign of any country in the world to date, with vaccination of the total population exceeding 80%. So back in March, when the team from HHS was here and we had meetings, I think one of the things that we talked about was preparing for this day that when we have to transition from being COVID-free to COVID-safe. And that means when the people come and they have COVID, we contain it, we protect it, and keep the people protected. And I think that's where we are. So that's why we continue to go to school, the flights continue, but what do we do to mitigate and make sure that we're safe? Kasi awal kada malmol mal mora school, lemru la iger rule gira dan mrul, ma skogi dir kamay, hindi kada masa sengara iger baby rasa dan mrul, lutso bakti dan kada klagar. Adi lungi la baik ma ulan un sa ira ite Dr. Yano, ma Dr. Hancock, ukla boldu sese, and then maybe we could mura question and answer. So Dr. Hancock, Dr. Yano, I give you the floor to begin this next phase of discussion, and then maybe after that we open up for questions and answers.
Okay. Thank you, Mr. President, and thank you to inviting me, allowing me to come and continue the collaboration with Palau. It's really an honor to be here and work alongside with your team. This pandemic is certainly a historic time, and I think it really has demonstrated the strong and enduring partnership between the U.S. government and Palau, and for me to be able to come and help work with your team is a continuation of that. And I have to say, Palau is really amazing, just a global leader in taking on the pandemic, utilizing the vaccines to really create a layer of protection that is unprecedented in the world. And so I think, as you move forward from when you first, prevented introduction, and then Palau came up with the Palau model for getting people into COVID-free areas in a safe way, and then really performing and carrying out a vaccination campaign that is amazing in its ability to prevent or help prevent COVID-19. Throughout all of that, all of those things that you did and everything that is being done in the globe is really in response to COVID-19's ability to really cause severe illness in some people, can cause hospitalizations and can cause a lot of hospitalizations that overrun the hospital capacity, and unfortunately it can cause death. And that's why throughout the world, countries have struggled with how to respond to this. And I believe, Palau is way ahead any other country at being protected from COVID-19 and the effects of the virus that we really worry about, which is that severe illness, hospitalization, and death, because you have put in place what CDC feels is the foundation of really addressing COVID-19, and that is good vaccination coverage with appropriate vaccines. And Palau has done that. And so your first major layer of protection against COVID-19 is there. And we know that the individuals that are at highest risk of that severe illness are people that are older, people with comorbidities, and those people have generally been vaccinated in Palau. So that's fantastic. And then I think as the Ministry of Health adapts their approach to the changes that are occurring in the pandemic, especially things occurring outside, I think they're doing a great job of adding additional layers of protection. And of course, one that's been there is sort of your entry process, and your systems were in place to try to identify COVID-19 when it was introduced to Palau. And these two cases, I know they may cause some anxiety to the community. They're actually a demonstration that these systems are working and that you identified those cases and your team has been able to isolate them and do contact tracing. Now, so I think there's certainly things that the Ministry of Health looking at schools. I think you may have seen in the U.S. we found that schools are really important to keep open for the kids. And in this current setting in Palau, where with just 2 travel cases, you definitely would want to keep schools open, but also down the road, and the ministry is already well ahead, thinking about what are those additional layers of protection that can be put in place to help protect those children as well. And so I appreciate the opportunity to be here and collaborate with your team. And also, I think you folks know that, our support with vaccines and, other treatment modalities that help prevent hospitalization. It's really fantastic that we have that close connection and are able to help provide that to you folks. And then seeing just how fantastic Palau has done at protecting itself during this time. So thank you for the opportunity to be here. And I'm looking forward to the future collaboration with your team.
So long blas the last mole mga deba igel dal mo igel maklol gora dai ratigingel mong laseng nga ka aurora Guam lo relevant adra CDC lo nga siya igel blura associated Pacific Islands mal mrenga sulela قبل بلا ما بريزيدنت الشو تايرنيل ماي من سبيل لوبنجيلا تيم MOH Minister of Health ما Human Services لو مسيرتير تيال response الجيرلا إيجال تبلو الكيس مون كل ده مقتغرة أيوبو Girel ol kabay, ay gel mringil ser, ay gel duk mun severe illness. Ngol kabay, amon New Yinger Hospital. Ol kabay, ser sebed el mosmel madringi. Mung segidia while gotel level, sel while gotel blabel, urered el tomer tial ser. Segidel lurior, malungil al sugo marbek laad mal uben betok laad rablu am la mayo bortir seguidi agot protection ongerung ay gal dosad el melgo tiging la mask ma meeting lo mantirar betok laad ma meeting lo ngar al selablay ma school mung makarae ekdo sig al do ulel إذا mga sadar تيال سير من داخل المويول. أي قال تبلو السير أم ليل وجيوا أمرايل. دي ملاغ السير الدلوب رابلو. ملاغ أمرايل مي. من ملاسيت أي قالوا ريول بلام رول Ministry of Health الملان التيرقال أذر أمرايل أو ريور. إندي تم التيجرينيك ملاسين tara mosbi rulia di merda ada bolgugu etamalang ringin diagal ilil mo ngim luror ubangay maklubse ruri tadong ira kotel sils el mut el malang ringir o ngay mludor le selbo do ngay e kadmom dingek mlaseng kadmagarang magdmo selba akla mang malmol muk mlaseng a school aguk mongod atletelel ending ngartiale rul sande mang mamalas mludor lo bantirir wakafar el mrul aigel plans aigel dorul el mga sadar ti alser mandagal lolomol malubeng America rablu. President, dito Isaac mo iyo si lilutul activator ngi. President mong serial activator ngi arwa ka faram lamurior mong tirgagi del weekend de tulurior mong kamisulang or segi del activation President.
Namaste lo que era que. Malungil itasil si President ma Dr. Yano, Dr. Hancock, Marvekla. Akari ka tablong ak mo kera kere bebila atikani akarir. The first question that I have is to Dr. Hancock. We of course he says we don't know yet. We don't have the capacity here to identify whether it is a Delta variant or other variants. And the process of testing has been changed, so it's now going to be when they arrive the day after, they will get the test, and then another in 5 days. So for the Delta variant, how long is the incubation period? And are these testing really going to show us anything once it's been done? And also we heard from Guam that there's a growing number of people that have been infected. They also they're vaccinated, but they've been infected, they've been hospitalized. What's happening in Guam that's we can learn from and probably help prevent that from happening here. That would be my question to you. And then my second question is really to the President. You know, the concern that's you hear in the public and possibly been disclosed to you is people want to know if this is coming through Guam, why won't we close that access and fix and resolve this issue locally, or is this the new normal? And that we should be continuing it while we put in place mitigation measures. So what is your, what's the thinking behind the policy? So those are just the two questions.
Okay, thank you. Yeah, really great questions. So the first one regarding the testing. We won't know for sure. We won't be able to confirm the testing of these first two positives as far as the sequencing results that would tell you what type of variant it is. We'll be sending those off for that confirmatory testing, and that result will arrive later. Despite that, waiting for the testing, just because of the patterns of transmission outside, both in Guam as well as the rest of the U.S. and globally, is really dominated by Delta variant. And so the Ministry of Health is moving forward and acting like, hey, this is probably Delta variant, so we want to respond as you would if it was Delta variant, and then would find out later, but automatically just sort of responding to it like it's Delta variant. The question about Delta variant incubation period. So one thing we found about the incubation period is the time from somebody's exposed to the infection to the time that they actually start developing symptoms. Also in there is the time from when somebody's exposed to when you can actually do a test on them and they're positive. Because as you can imagine, you may get exposed to just a few number of viral particles, and they start growing in you, and it takes a while before the virus has grown enough before the test can identify it. What we found with Delta variant is that time for the virus to grow is quite a bit faster than the other variants, meaning the median time, so the time that was sort of in the middle of when people would have symptoms for the old variants was about 5 days. They're finding that for Delta variant, it's more around 3 days. And what that means is people get exposed and the virus grows much faster in them, and they can be infectious earlier to spread it. But it also means you can test them earlier and get a positive test earlier. So it may sort of help with identifying the virus earlier as well. And my understanding is because of that information after our discussion, that was one of the reasons why the Ministry of Health said, hey, let's add another test to that screening process because we know that the Delta variant is going to come up positive sooner. Your next question as far as Guam lessons. I think one of the big lessons from Guam and the rest of the U.S. is that Delta variant is amazing at finding and infecting unvaccinated individuals, especially adults. And when we look at both Hawaii and Guam that didn't have the coverage rates that Palau does, but had fairly good coverage, the unvaccinated community is really lots of spread there. The individuals that are unvaccinated and in the hospital outnumber the vaccinated 9 to 1. So it's like 90% of the people in the hospital are unvaccinated. And because of that, the Guam governor has actually said, hey, this is a pandemic of our unvaccinated in Guam. And they've put in some recent requirements for people who are not vaccinated that they have limited restriction of movement. And that's where, again, I think Palau has really maximized that protection that vaccination provides to your community against those most important aspects of the disease, severe illness, hospitalization, and death. And while no vaccine is 100%, so that's why, when you have a lot of transmission from unvaccinated people, there's going to be some spillover where you're going to have some vaccinated people that may get sick from COVID-19, and we're seeing that. But for Palau, the fact that you have such good coverage, that really reduces the main thing we're worried about COVID-19, which is not really transmission. We're worried about transmission because of that severe illness, hospitalization, and death that is what the vaccine really reduces. The vaccines are as good. They're finding they're as good against Delta variant, really, as the other variants for preventing that severe illness, hospitalization, and death. So while there is maybe a little more transmission with the Delta variant because of, we're talking about the incubation period, it's still, the vaccine are still exceptional at preventing severe illness due to COVID, which is really our main concern. And so, in our, like I mentioned, in that whole response for COVID-19, the primary foundation of any response is good vaccination of your community with a great vaccine, which are the vaccines that you receive from the U.S., and you guys have obtained that good coverage. So you have that huge foundation there that really helps keep Palau COVID safe, even in this sort of changing situation at the moment.
Ilang second question.
Okay.
Do you want me to repeat it?
There.
Oh, okay.
Arun ko mo leader sel tingin lang tora belaw.
Lamang na ngay.
Okay, kamo lusin mo ngin. Di gotrule kida wayir tilum. Kudul mura process rigid. El vaccinate ra adra blur bela tiaul mura January. I remember and the election Kafar, and that was probably the first time I had an opportunity to meet Dr. Hancock on Zoom and Dr. Cash when we were talking about vaccines coming to Palau back in November of last year and trying to find ways to make sure we could get them all here and get people vaccinated. And I think at that time, the thinking was as soon as everybody is vaccinated, life is back to normal. Unfortunately, that's not the reality. We've had to adjust. And we still have restrictions because life is not completely back to normal because you want to keep people safe. But we know that we have to continue living. We have to continue making sure that people that are ill and need medical treatment can go get medical treatment. We have cases of people here in Palau that have waited for medical treatment for 8 months and did not have the opportunity, and now we've lost them. That because they could not leave. So having flights available is also a medical emergency to making sure that those people can get the treatment they need. It's also bringing families together, students to school, and getting people jobs that they need. Because some people need jobs to survive. Other people maybe not, but some people, I think a majority of the people need jobs. So, kita ulmura tial nomrega raba November. Tial uldaso mamalay gal vaccine me uldaso sel time na se hindi me gal vaccinator adam nam kadala mo ni mokl mrula gal so. Hindi kada nam tigeringin wa se auri ura gal nam hotel albuil diri kada sal mor seyit. Kada la vaccinate hindi kada man molmal el gargik lendi gal so dal me arak te lo prid en ngari ar adal el mosmer kada mal el mage gogid o meseringi am subari. Di dul dongale atiagid. Kada nem dangel wa se selbo damne gal maigal vaccine eng moria time enya mesoi se betia raktra ablur vela madururi amruri da sem kada selba akla sea awul kada mlarti aliobo kada mururi da mo selba akla mal sumo mesoi se en digal el wanga el tomaliti albulu hala us per example us peria a doctor hen kang sedro ase tial variant malu betia rakta al sel sumong ngal mautra yelam didirte el utma ma oriamala en dit maute mal bogrurte el maraana dil sumong mora abasiol oradim lam tengla ulringie edegims nga adekal sal sebel ngidre lal sel bla nga igal yobo en wa bla dik masit tial oriamal matial utma lamo meringiat mauta ngawri masea ule kada udol turu klil wase oi kada openera balwad matamaral merat dingin ay gel doru awol ndri gamal mal ngari testing taiwan amal ngul kada tester tir airport magdana se laster te lire edi merbela lim ktbsel muter maral akwam ada tester tir with merul sigang ruera almei 5 days after almei di lam tingna se maybe ngari tir amersel but tester tir sel lager del direct aye adon mol mal adjust and make sure abal wada sel baakla maradan ngara al sel asedan men mol ma yel gida yadan murura bekal sil angal gida sin mora school rada sin mora stoa sin mora hospital sin mora murura yel mora kamaldi murura yel rogol activity ni require al sel aklang artira bekal sil mang akari ma se kada mol mertial doruri ya gumral wase gida amlar mula yel ngara ler men mol melo mes review make sure gida asal baakla ding si adam mol may activity loro mang kadol ngi trak loro ngara balu mal ngari imor example di lo kamalungil example ngase al baby time ing agire del dia kada bere sumo da tokola del bakling sometimes in diwan al adam ngara ara bertak di mo dia kada wes balu rogoy ngire del make sure ndekal san mo ar mun se drungil o seyed lom dasu o mesel girela klungela belar rogir mar adar rogui le bebi rataimen ukti wana al ar kada malmo bulu rogui mo kada mo madakta di kada ni tra kallo reng adra bulu e gida de gadi to kora di isa to ta se trelitian dul tuira arsemo mun kada maran beringa sulera bulu ramrigen de gadi البسكيتا يوبو نترجع expert CDC اللي يوبن قدرة ترجع بكل ساندي بكل لونيم لوري بيسه غفار الغرا كول لو مجلا ministry of health القدم صادر بلاو ما يجل دورو يت ريفيو مش هسه غرا نكسل دورو من سه تيجدر الدريغال ستوبرا ولا المريلا يدريغال ريال تلد تميل واي التايم التوبت الموسو جد اللي واسر almer al sela march el dire galor ngase orgid raul daso no mesay wase igal bebi rablul mliya kargid mablul adam ngara raktri ngara igen moru le kami amongil sel bakle ngira ar rablum mong gada أقوم واسي أدلة دا ملمول المرايل بدول سل الدوم دا سوريا بيبي أتم قد تيبل أجست راقوس دي مرايل دي قام دا سنغ دا قلقيرة الوكمال مبيك مكتو تتلوتن دي تيدا دو تنغلي دكتور يانو يرايتي أقوم واسي أموكتغر جيدا واسي أيقال بلان جيد أسي دا أجست دي قد يدر الليل واسي دي تيجي دمرغم الشوم أسي سبعان لما دا قلسي أدرقان تروري إيقادا change the plan di adomorani el altama ose a plan ergit urior kadam de emertigat teru, which means testing works ngiran moklorud ya system ergit urior marada alsimel igida mo moklorud em denga se kadam el mol masagal plan ergit tirgang artial mo sergit el mutel masasing rayget se el sumok lu tsmisi sulang.
Good afternoon, Mr. President, Dr. Yana, Dr. Hanka. My first question is for the President. School is open, and what about large gatherings like the night market, sports gathering, and funeral? Is that will that stay? Will that go on? And for Dr. Hancock and Dr. Yano, I think the concerns are for the unvaccinated individuals, including our children, the unvaccinated children. So how does the Delta variant will impact our children? And there has been a report that it has been children are impacted. So how can you explain that?
So, first of all, thank you, Bernadette, for that question, and I think it's an important question. So, yes, schools remain open, large gatherings can still happen, night market will continue, nothing changes. We believe there are imported cases, the cases are contained. We're fine, but we should always practice good measures, which includes mask wearing. So if you're in those large crowds or in enclosed spaces, wear a mask. It's not mandatory, but it's a good practice. So we encourage it. And I'll turn it now over to the experts.
You go ahead. The question about the kids and children.
Well, maybe you can say that in Palawan.
So, yeah.
قلت له قول سيل كيرا سي مقرا سكول ما يقال مكتول سيقد قدم المول أدي ما بس ما ملاقيرا سي قدم مقرا يقال مكتول أندي بالمروا سكول يقام المول من غاري الأكتيفيتي قدم المول من مرا سكول لما المول من مراقم الدي لما المول من المرولة يقال أكتيفيتي لو نايت ماركت اللي هو إلي دي ندير قالوني لا براكتيس هيجي لوني براكتيس هيجي ده سيل مكتول سيقد السيمر السيل أبلاي إن ماسكين مالوني هي الهلب السب أخلاق من سير أخطوط تلمسة هيجي البتول البلول غفر بلول مساعد الواسق يجري مشوا إيماد يجري distance هيجي ده براكتيس رابك التايم يا قوم ده سيل ترى بلا ده سوبير أدر بلا ومال لو يلا يجلو سيساق لما يتيل دريقة دولو هسه مو ماسك كم يتيل و ماسك الرقوي مكمل مسودان لين سي أول أوتيل هسه كده غريق لا سواد السلبة أختم مسولا.
Yeah, thanks. So the question about protecting the unvaccinated, especially the kids, right? And so in Palau, yeah, those age 12 and under are the only individuals that are not eligible for a vaccine yet. And yeah, that is kind of concerning, right? When you think, oh, okay, well, we've got people who are older that are vaccinated. But there's some things that can be done to protect that group. One of the most important things is making sure that if you are an adult who have kids, that you are vaccinated. And if anyone who's around kids that are 12 and over that can get vaccine, that they should get vaccinated. Because then that really helps limit the spread from adults to kids. And in through the history of the pandemic so far, now it's changing, but it looks like originally a lot of the transmission came not from kid to kid, but from adult to child. So if you are unvaccinated adult and you have kids, you want to protect your children, the first thing to do is make sure you get vaccinated. The other thing, we talked about the layered approach, so adding additional layers of prevention. One thing I'm sure parents are worried about is school. And so right now, again, to reemphasize that there's not community transmission, so that we know of, so that allows for schools to be open and those sort of things. But there's also things that can be done if there is more transmission that can help reduce that risk for kids, and that's mask wearing and those sort of things that Ministry of Health has plans for and are revising the plans as they adapt to the additional information. But the last thing is just to reemphasize why have we gone through all this pain of isolation and rolling out vaccines? It's all of it is to prevent the severe illness from COVID-19, the hospitalizations, and the death. And fortunately, although Delta variant does cause more infections across all age groups, and so therefore will cause more infections in those under 12, they still have extremely low rates of severe illness, hospitalization, and death. So that's another benefit that although kids are not vaccinated, the number one reason why we're vaccinating is to prevent that severe COVID, and it's very rare that they have that already. So that's a sort of one of the fortunate things that we have is we're dealing with COVID-19.
Mudlong ngal Dr. Hancock amalgok na si Tara Rolel ekada masabaak tirgal ngariar krir truma erung at tirgel maklol adl lob titrir lo ngal gartir amma yobo lesel lang yobo etabay sobak klingal ngal ngaringa kora ewatlel mandabol ser direct malgok na sing Delta asab elimur arbetoklat ndagdil makloma imur arbeklat age group ding dagal malgok na sing ser morangal ka dagal boligel maklol ser dagal bol new yingringi dagal bol ser madringi ngimul ngegrel ser di tararolel tamosabaakla at tirgal maklol adlo bo lob tirgal ngal gamayo bortir mung dagal liuringi letem lom tigl klase dagal ngal loyulil mora tarangal gra school ngara klol adl morangal.
President Ungilita Silse. First question na nga follow up persel karila Miss Raklay. Concern public wase understand sel omol goringira sendial close travel between Guam bela do sparing mura school Michael for many other reasons. Aba I concern adangar sel 3 days still 72 hours lungwa testing was it they have the COVID or not segi del 3 days bagi clearing was silsile de club same by sub ila adal ngwa rakte ngul mirbelaw ma question nga kasi kautel mlaw is was ka mo testem ra a day after segi del 3 days and dial direl sub directly si ila blur belaw Chester segi del mutul ko pangil mo itel do rurung ira Taiwan mang instead ra by protect ra era ligir ra balur belaw stop airport
Yo continúo malung ilgiar kida ablura Taiwan mal le urula bangiet igut mukli selo asika testra al sel airport ru era ngasar askogi se urera Taiwan le Taiwan triera da walom ur sel blura Taiwan rogui emerbela akoma tribal modo le rada ngara hawa el mel connect rakwa ngara shaba le mel connect rakwa igade batemin ngara kwam Mumring rigida tester tira kwa me edega testing capability rakko. Masya ulo ase tu amne urdas wa se tigi de bla subi wa se bodo ling intersel amars se lager der belau ega tester tira belau. Kadamla prevented in 72 hours ahead. The is an extra measure se lager der belau ega der muter tester tir se lager. Seguida amo extra global masab akhrigit. So seguida actually to ramregila dang.
Next question to the medical expert. For the two individuals who were tested positive for COVID-19, what's the science behind it? As I understand, they were vaccinated. Were they able to transmit COVID-19? And did we dodge a bullet on this one? We were just lucky that they did not transmit COVID-19, or is it that since they are vaccinated, they were not capable of transmitting the virus?
Yeah, excellent question. That's one of the changes that Delta has made us face. Is that previously it looked like the vaccines, if you were vaccinated, the chance that you got infected and then were able to spread it were extremely low. And if you recall, CDC said that if you're vaccinated in the U.S., you don't need to wear a mask. You're okay to do that. But the science is starting to show that perhaps for Delta, one, you have a slightly increased risk of getting the infection and also potentially could spread it. So that's why CDC reinstituted mask policies across the U.S. And that's one of the reasons why Palau is also looking at, you guys had changed your testing so that you can identify folks earlier. We don't know for sure exactly if somebody who's vaccinated can spread it as easily as someone who's not vaccinated, if they're one of the unlucky ones that get it. But despite that, being vaccinated still provides you the most important protection, which is the vaccines, even against Delta, are very effective, supremely effective at preventing that serious illness, hospitalization, and death. And they do help prevent you from getting infected. So then, therefore, help reduce that. But the big thing is that the reduction in severe illness. So with these individuals, this is one of the reasons why the ministry had the testing at 5 days, is to try to identify, even though everyone's vaccinated, try to identify if there are some breakthrough cases and being able to identify them and get them isolated before they spread it further in Palau. And so it looks like the system has worked this time, and it looks like the Ministry of Health has adapted the system a bit more to enhance that as well. But again, the protection level that the community has because of the vaccines against what we are most afraid of from COVID-19 is Palau's got the best vaccination rates in the world with the best vaccine. So you guys, that protection, that sort of COVID safe that you guys talked about is a really strong foundation that's really protecting you to an amazing degree.
Riter tirgal del teru the quarantine 10 days tirigel mle close contact the quarantine al up the tirigel mle close contact the ngarab la self quarantine ngara tirigel
So lang ragel ngarila tirgal case isolated tangara isolation 10 days tirigel close contacts and mildang self quarantine monitor the vehicle seals and other surveillance and monitor tir girin metest day 3 ma day 10 so far ang tirigel rogul close contacts direct gora dia symptoms 13 o mesin der tiram lamrus mong direct tara added protection and ding say git self quarantine at tokol mortias and dia lomais unless ang tamo siga grul adra ministry rahel melmol monitor tira bekal sils imro te test ra day 3 ma day 10. Hindi tirigel positive case adi ngar isolation at 10 days. Well, imro test ra day 10. So the question was quarantine arrangements for the close contacts and the isolation protocols for the positive cases. So again, the positive cases will remain in isolation at the Palau National Hospital for 10 days with a test on day 10. The close contacts tested negative on day 1. They are self-quarantining with restriction of movement requirement so that they shouldn't be out and about except to seek medical care and then come in for testing on day 10, day 3 and day 10. But I think so far all 26 remain asymptomatic, but the Ministry of Health surveillance team continues to monitor them daily with their situation.
So, Mr. President, muluway sa pungani tigal terul positive COVID-19 ang tela club se gom sabil momdek na sitigam la model Algeria tel na model positive ma kada taying artir ang ngari akar lola itiragi COVID-19.
Dr. Let's ask the question to Dr. Thane, Dr. Hancock. So the question, Dr. Hancock, is what's the appropriate number of days that we quarantine them and then release them? And then do we give them any medication or what would be the appropriate?
Yeah, excellent question. So, so far, CDC recommendations have for if somebody is infected with COVID-19, the current isolation recommendations are 10 days of isolation. So, is if individual isn't immunocompromised or has severe illness, they find that after 10 days they are no longer infectious, and so they can be released. There are a few individuals that if they are severely ill, let's say in the ICU in the hospital, they tend to extend it longer than 10 days. So it'd be 20 days. And really it's about, and you want to make sure that the person no longer has fever. For these cases, they're asymptomatic, meaning no symptoms, so it's 10 days. For quarantine, which is when somebody's been exposed and you want to keep them sort of sequestered away or away from others so that if they do turn positive, they don't spread it. That is also 10 days with the test is what CDC recommends. Sometimes there's even recommendations, CDC says, well, maybe 7 days with a test could be acceptable as well. But there's different sort of risk levels. So sometimes for CDC, because in a lot of states, there's just so much transmission. They can't do the full 10 days, and so they do the 7-day and test out. But 10 days is good with the test for quarantine. And Palau may be having something that's maybe a bit more conservative or in line with that.
And then medication.
Oh.
He's asking.
So for medication, in general, there's not really many medications for asymptomatic COVID in general to speed up the isolation period. But Palau does have access to several medications for COVID-19. Some are for severe illness. If somebody's in the hospital, there's medications that can be given to try to help them recover better. And then for individuals who have COVID-19, especially early in their diagnosis, who are high risk for severe illness. So again, I mentioned that our goal is to prevent that severe illness. One, the major tool is vaccination. There's also a infusion, and that's an IV infusion that can be given to people who are high risk, who are infected with COVID-19, and you give it to them before they need to go to the hospital. You give it to them just after they're diagnosed, if they're high risk for it, and that helps reduce the risk of them going to the hospital. It's sort of like an early treatment, and Palau has that, just received some new infusion, some of that medicine as well. Right now it's called RegenCov. And so that's another tool that Palau has to maintain its COVID-safe status and help protect its hospital and protect people from going into the hospital.
Siyang mada,
Nggak mau itay lang eh. Doctor yun.
oy. Ger amlara Mr. Talamsuk nga se tirgal el smer nga hospital nga ringa karal lolay ma Dr. Han Kaka diluk mong nga ringa karal lo Jem Kong Klel el lwa IV el dangal mastrir tirgal adal mo smer el high risk arwa sugal ma arwa makita hartartir asbedel dima mail mastrir ru era el lolgabartir men dagal bol close mer ma dagal bol New England ra hospital ma igen aringil blal ngay arwa abriter mangaringil hospital lo labar elang mangaringil igel go karel lo mastrir tirgel New England tirgel mal namos mer mang ang kabel oil klaseng ngaringa o libel tletara u grul. Ako libel sel yobo. Dilsugum timeter se ang mga telmorsal longerung en dirk ngaringa tletal dom karatir. Lo spe ay gagid lorus el dirgum loringi ma hospitaram namay.
Hindi ka ulong alilarak.
Sula Mr. Gafare, Gel Director of Health Services Rabluram Rigela, Luaisak mo September 20, cell booster vaccination na girin mo malaria adal. Le after 8 months itiagid el mother nam tal Pfizer amo weak malubeng mo diagal effective. Kidan diag da take out risk al sumag continue lol sisabra other akrel vela al meso isur vela we e dirag wo hu segir del el vaccination al sum tegir el fully vaccinated am lamo mi itut
Kalak ko bak pa sa Dr. Hancock malgora sumodi sa igidil al tetele la talang tingil sa igidil long edel dose malung third shot e mo ko po do sa dala ko tetele la wasim magrabo do rusura avelaw. So the question, Dr. Hancock, is about the third dose and about the effectiveness of or the efficacy of the vaccine after 8 months. And who needs it at this moment, and is there any visibility into when everybody else would need that third dose? And if there's, can you also explain the difference between the third dose and a booster shot as well?
And the risk, if we don't have it, are we at more risk now that it's already 8 months in?
Yeah, so the first third dose that has just come out, that you may know of, the additional dose recommended for anyone that's fully vaccinated with a mRNA vaccine, which is Pfizer or Moderna, that is for individuals who are moderately or severely immunocompromised, which means their immune systems, for whatever reason, whether it's special medications or a health condition like cancer, that it's not as strong as the average human. And so what they've found is that they need 3 doses to be able to get their immune system up to the level where it's good at protecting them against COVID-19. And so if you really look at how this extra dose is written, this third dose, they call it an additional dose, not a booster, because it's actually a third dose to get those people whose immune systems aren't that strong up to the level that they'd like it at. The booster shot is actually for when you've had someone who had a vaccination and they have a good immune system, they had appropriate coverage, but that strength of the immune system waned over time. And then you give a booster to bring it up again. They are, as you know, are looking into whether or not boosters are needed. They're looking at a wide variety of studies coming out from all over the world, and including in the U.S. And when I say they, it's FDA and CDC. And you've probably heard that the leadership of FDA and CDC, along with the White House, has come out and said, yes, it looks like we are moving towards approving boosters. It would be for folks 8 months out, and it's just another way to leverage that most important tool, which are vaccinations, to really help increase the strength of those vaccinations. Fortunately, in working with all of our jurisdictions across the islands, they have been preparing potentially for this booster rollout. We won't know exactly, till FDA and CDC have given that approval, but it does look like that may happen. Again, it's looking at 8 months. So 8 months, the people that were early vaccinated, they're just about at 8 months at September. So it looks like the timing is going to be good. And if you think about that some of those early September early vaccinations that were rolled out here in Palau and across the U.S., they were very limited numbers, right? That was when we didn't have much vaccine. The pods that used to give out vaccination weren't very big. So we're confident that when that booster becomes available, Palau and many other places will be able to reopen their pods and be able to get those boosters to folks if they get approved and get them out quickly to add that extra level of protection.
Mr. Talam sendi soda bol blak takluk mong Dr. Hancock, misada erul batengela yobo. Misada se longe day yobo. Mortirgel lomgodok mut mitut immune system ertir. Immune system ra batengeda ay gelot ngakla ser. Mong tirgel mitut immune system ertir. Awata tirgel mala kurula cancer. Tirgel mala mora bone marrow transplant. Tirgel malaba msisi steroid. Tirgel gidel adam ituta immune system ertir mong selongedel lorus ongedel requirement ndakal booster. A booster akuk ngodal tokoy. A booster ak mala se tirgel adel diakal sera immune system na badingir. Ending mala mo koram ituut aigel lurerela ayobo. Abodolisi irtil mstriringel longedel duk booster. Mabol blakatakl mo CDC mlatabdia awdaswel na se tirgay gidel ituuta immune system irtira mo malar ongedey lorus. Ya booster a moriul. Hindi ka kabol blakatakla.
Ngil odo songe utelinga ma Dr. Yano ma Dr. Hanggang kumin gawin mutakla kami mentong artiang. Timas ka gini mas kumiakri la edin honge bundita mo hensi. El al sugum tirgay del terung amlera sera Sunday last week sera Friday tamil tigar tilo se to labay karak. A question o se elang temotelal adame lo barak. Kita se elma se namudiakal se ela artok tangar gida mo hospital gida lungara artigam kat store omra. Sugum ela tirgel ner eli mo test tira Friday yung mutik lo se terun tede mong segi lo se magrar elang at what point eko store ngilo se kala stop it take kira se ako telger ongerul kira se ela tirgel el toktang marnurs em no mes tirgal smer tirgal terror ela tirge osisul time et malmol lo mes tirgal go bebira patient tir tirge tirgal mo test til wase dia lo singil mor tirgal smer tamlang mai karak malu bendia ya ongedel gera wase ela tirgal terum malu betriel go mamral me sois pro tirgal tiro la terra sebi lo yu del mora arbe bidarat tirigel mlama urus alwes iloid el morar belau el mlama amrus seguida kita ke
Ay mogel toram ya merigel mul.
algo toker rakaw
Okay. He mentioned 3 questions. One, these individuals who tested positive, the question is actually to the president. When do we close the border because of these two infections? Number two question is, those who took care of the two cases and now are seeing other patients, what happens to that scenario? And the third, oh yeah, and then these two cases, can they transmit infection to others who are vaccinated?
So I think as far as closing the borders, I think, with these two positives, that would not be something that you need to do. Again, we're finding that the vaccines are especially effective at preventing that severe hospitalization and death, which is our number one worry, even with Delta variant. I think, and I'll let President or others if they want to add more to it. The question about the hospital staff that are taking care of these patients is an excellent one. Initially, early on in the pandemic, there was worry that there was going to be a lot of spread from patients to the healthcare providers. But what we found is with appropriate PPE, knowing that these people are infected with COVID-19, it's actually very rare that a patient infects a healthcare provider. So these patients are in the isolation facilities in the hospital with the appropriate infection prevention control. So these healthcare providers are not considered close contacts because they're wearing the appropriate personal protective equipment to prevent their exposure. The other question about can the two cases spread it? So, fortunately, asymptomatic folks maybe don't spread it as often, but they can. And that's why the Ministry of Health has these folks isolated away from others so that their chance of spreading it, it's hard to really measure exactly how much somebody can spread the disease. And that's why if somebody's positive and a new positive and not a historical case, we recommend that isolation regardless based on it. So it's not that I can tell you how specifically infectious each one is, but they potentially could be, and that's why the Ministry of Health has isolated them appropriately.
Beko kila malungil ger. Mkotrule gira de lo mesra capacity hospital regit. Lo aseng tetela la silo tagartir. O mesra lo aseng ngrasel risk el trial adel tira amosmel el wal selectira severe. Seguida dobal malboda be decide lo aseng namo gira del shutdown pada magarang. Di sel domeso urma atleta sel domesra ildoisra other belau maklungela vaccination rate belau ngade ka se the richer segi the point el wasengira del mugasimel len ndega de sat el hospital gidel len alakla el mop toisra adel smel mo soisra al sel because kadam la vaccine segida Trigal adre le triga asymptomatic. So amrari de mal de qabul da ttril mo hospital. Di tiawal first el geyser gid matangar hospital. Di triga ngasil el simra ablirir marubin hotel room tira de qabul ttril mo hospital le triga de gal ser. I mean de gal ser wal ngari raktir. De dio barakt ni de gal سمعت صار تختار يوم سكار سلاش ده تباركت ندي خلص من بترجع المو بتوخ عشان دي سيل جيرة المغربين ترجع لو بارك تمرال سمير متصبح أي جيد سيل بول بتوخ ترجع تمرال جيد رمز عشان كذا كذا نسوم سري دي سيل دور تيرو مو مسوب may disira adar belam lama yo bortir ing ada kal selu klomeseria Dr. Henka kal ada kadang lak persegi del mo morikora se kiyo del mo simana ele maybe nga se kal askari mo ay sel tetela la kwamre lang. You know, Dr. Hancock, I think it's important for you to share the number of hospitalized patients now in Guam versus what it was last year. Because the question is, so when are we going to shut down when there's too many cases? And I said, well, first we have to be overrun at the hospital, but we're not, based on data, based on the size of the population that's been vaccinated, it's highly unlikely we'll ever have to shut down because we'll be overrun, right?
Right.
That's my understanding.
Yeah, and of course, I mean, you guys will adapt if there's different variants. But
Yeah.
with the Delta variant in Guam, what we're finding is, you may have heard Guam, there's many cases in Guam. And when you look at the surge in Guam, it's almost a year ago that Guam went through its surge in the fall. That really was the biggest surge in Guam. And as they found cases in the community, they found that sure enough, the number of hospitalizations went up as well as the cases went up. And the peak at that point was 105 people admitted at one time in the hospital in Guam. And that was very difficult for the hospital to maintain, and they needed to get extra help and manage it. Now, we're going through another surge. This Delta variant is very good at causing infection in unvaccinated individuals. So we're seeing many cases. But the number of people in the hospital in Guam right now is 20. So we're seeing that there's a much larger difference, right? That the number of people that are getting severe COVID is much lower, thanks to the vaccines, than last year. And so that's really why, if you look in Guam, they haven't really shut down like they did last year at the time, because the hospital still has some capacity there thanks to the vaccinations. And again, it's that primary thing. The vaccines are so good at preventing that severe illness, so it really helps prevent the need to shut down.
Sala Mr. Presidente, tiala mura tirgala dara io ozil girela cell contact tracing. Homalgot masanganya 26 cell close contact blam tested negative. Ela cell flight el mera August 15 tirger rogul passengers em la cell ngarbela tomor cell el 50 mo malera testing mal ube kom la start el modo du tire mo tester tire.
So tirigel mler August 15 rokui amne tester sera Friday. Tamle over erul darta ame tester sel silsa. Outra tirigel del erul darta ma ode agumdas mle 200 tori ame tester sel silsa. Tirigel del teru amne paseti. So igual deja el mut el tester segui del tester day 5 segui da wal play clear. So tirigel del tool el positiva mildang au ulmo mumleru la contact tracing hale qadi talib mutel smodis el contact tracing so sayid el milga taqla far wa sa contact tracing close contacts at tirgel adel lulbanget tirgid el smer el at least 6 feet adel longolir el mobudul ngara 15 minutes or more sayid qa definition close contact tirgid el mlamadang al 26 amla test magdam la se amla test negative okmong mlaringi ya one tirgel mle test positive and then nagduguk mlengoriak el more tirgel secondary contacts tirgel ku contact ringel contact di el time el sum tamle dim le negative rokui engwal wadim lor seiki di ego korastope mengila ku pesel let's say ngar bebirar madang al mle close contacts tirgai del terul smera elang tirgel mutel mera testara onge del klebsei matamera klugo kolongeru lurior tel mutel test el mutel yegidel antigen ma yegidel el PCR tester klugo el sugum tadiga negative etamelo qadamal mol mluaseng disegidel circle ratigidel contacts to mesertit sugum ngarinya ku kwan el madang and then qadgu klumutel morsegidel walongeru daw ratigidel contacts tirgel contacts alduma malgol waiseng malbeto garadelo bodong el mel el pekik leta wal qora contact tirgayid el contact matirigay dia ka o mesertir unless tirigay del contacts awal bol positive. Ela selbon merek selong edel test, selong edel klebsel test, walong erul test. Ekadam ngi lemor segi del true el klebsel lo goring kal toktang lo segi del period. Segi dia isolation period, malubeng quarantine period or contacts marsmera. Segi dia milga taklilo sa CDC tadio isolated till 10 days and din dia kal tester till. Hindi gida ko beyond say makadamo tester till selong ang true el klebsel. So tirgal terul smer, tirgal rogul contact, sabot the tester tir, ravaten. So kung the test negative, and then ako the really certier from isolation quarantine. Also kung the malmol mal positive, ako the mutal extendra a period isolate malubit of quarantine.
Bilgulak mo tirgel terung ilmla sils kogira. August 15 adimlakal transmitted tial raktel mo tirgel restra passengers.
Sab edel kumul waisay, lakadam larong ko sinang kal adel wasay wala incubation period malubeng time mo ultra adel sab edel tester ngil positive angara edel klebsay. Matira kamle email klebsay at me test. Min sab edel kora safely sel wasay di say del time le email klebsay adel ngole la belgerda eng bitirgay del terul adam le test el positive.
Dr. Hancock, you mentioned that the incubation period for the Delta variant is 3 days. Is that correct?
Sorry, yeah. So that's the median.
Yeah,
So that's the middle part. It can go longer, and that's why quarantine is longer than 3 days.
Yes. And for the other variants, it's more than that, more than 3 days.
So the median for other variants is about 5 days. Again, the long end period is that 10 to 14 day area.
Okay, so my question is the approach that we're heading to, whereas we will test the passengers the day after they arrive. Is the testing will it be able to test whether a person is positive with COVID-19 if the incubation period is 3 days, 5 days? If they are tested just the day after they arrive, will the test be able to detect the virus?
Yeah, excellent question. And because Delta variant has that shorter median incubation period, it means that you can identify it quicker through a test after somebody's exposed. But we don't know when people have been exposed and when they might turn positive. And so there's no one test at like the perfect time that's going to catch everyone. And so that's why, I think your approach or Palau's approach makes sense, that you have an initial first test. So hopefully you weed out a certain portion of folks that then after they arrive, you do another test. So you're identifying people early once they're in Palau and in restriction of movement. And then you're doing that test at day 5. So each time, although none of them are perfect, by adding those up together, you have a fairly substantial reduction in the risk. But again, nothing is 100%, but it definitely makes an impact by adding those extra tests.
Just a second question, Mr. President. President. Mlaring leadership meeting ra omira tel press conference understand the wasar sa kuk seltara brancha ra government tamle soril stober tialo marail ngara tadilur kaw mangra kuramle discuss ngara kuramle reaction tiril girel tial tirkal terul positive melokor tirkal ku press leadership kadat wasa kada malasam marurar adara balum dia kal salbagikle ya reality ngaringar adal kuramla panika ngaringa informational Gimilal wase atras kurbelak medel 17 ngal gamle absent rel al sils mang tiogel wasen guk ngamle reaction sel restra leadership. Thank you.
Kotrula meeting rel al sils ako mara laseng malmle productive emlonete alera arbek leadership logeragir senators delegates governors trier ugol narsel sorry logeragir amna tele logeragir mora Dr. Hancock ama kursa ngira ite gim narsel longera rogul ger magunda seng lobla tak kadiregal akmadayla seng klo aseba krengar our parents and we understand resegidel el seba krengar adam adil lobt triangal gil mora school seng lel bolung tiarak yesem lobla tak leng mahal ne klo nemle optoy sara adal absentra school el ansils betokor tira al amiringiri gidel waseng ngarakad mokmur el ansils mong kumoral wase amokte gara meeting rela masem meeting lang ila leadership om katakrin wase gidel adar bela selba akla tadam la vaccinate يصير قلت الامبورتنت المسج الاول من الغنية دكتور هنغا شو من شامل سو كلان الجيم make sure you get vaccinated there is no excuse بتيجي رغم رغم الجيم go get vaccinated سي قلت كلول ناس ولا سي ادري لي ديرغل سيل دمور تيل غرا لنغر لذر روغوي متريغل نغلغي تنغرا يكرا بلور بلا المي اوكمي اولدين غريد او مي مو ماسك ام غريك امرولمه يلقم ديمو مايس مايسي اجي كذا نجيريا دل مطنق الايمول بلو غاي نسيو نديري غل ملوب لغا تقري لا ما تدري غل دكتور هنغا قام نمغا تقلي هل سو متريا دل غال غرا 12 0 to 12 او عرفت ندير غل مسيسي وال ندير غل بورسل سيفير mild atقول له سبيريا mild or asymptomatic اجي كذا هذا دنيا giren mo salba akran dia adam adi lem dengan sekarang masih in mora school and they'll be safe al suo mong tabagik malungin halol amaska ndiri kal help protection ako se tokol school am la implement ro ser sense o mask ndiri kal prevent the spread mo ngala kandi kadiri kal mo encourage us rogol sense must be vaccinated sense se dongi resel final approval ra se do mo asing clearance ra FDA giret tial el vaccine el ayuda more seguido el level wase al sumo ka sense girem no tia vaccination card ergaw adang se al ana next level ra o si sakling way gelo lo ro la kabana ra komre lang al sumo de mo ba vaccine card de ka mortia de ka morse nga gire la bela el mon morse seguido el point ending da peremel towards el final clearance ra FDA which we hope it's going to come this next month. Igida nama se ed murtilo se igida a requirement. Ndi tida do dangali. Ako tium etul pasenter adre belal muklolat amlang o yobo. Mali misen makasal ada diri kan yobo. Ndi diri kan encourage tida se bom ngu leng al chon masabak rangal ka se abestel se emrulil ngar alem الدقل دي البرقة ونقول لهم المرة التريقال لما يجي قريل نقول يد الجيدة بتيجار مودرتي سولا أبغى Bernadette.
Mr. President, you talked about getting vaccinated, and vaccination is not mandatory, I understand. So how would you encourage those 18% to get vaccinated? I know they are included with them is the under 12 years old. And Dr. Dane, when can we expect a vaccine for the 12 and under? And there are travelers from Taiwan that fly in, that come in Palau that are vaccinated, are not vaccinated. So how effective is it for them when they receive the vaccine upon arrival? I mean, when does the effectiveness of the vaccine kicks in? Thank you.
Okay.
I'll go
Good.
first.
Yeah,
Okay.
go ahead.
Yeah, so unfortunately, the vaccines take a few days before they really start to prevent COVID-19. And so vaccines can't be used as a prophylaxis, but at least getting somebody vaccinated. So anyone that is in Palau that's not vaccinated, you want to get them vaccinated. And so even though they may come in and they're visitors, they're in Palau unvaccinated, it's in the best interest of your community to get those folks vaccinated. And then as far as when can we expect a vaccine for those 12 and under, I wish I could give you the answer. But unfortunately, we don't know yet. I know that there's efforts to look at these vaccines in these younger age groups, but at this time, there's no certain point that we can expect those.
So first of all, the Palan community has been outstanding in getting vaccinated. The adults that are eligible, we know about 99% have been vaccinated. Of the 12 to 18-year-olds, by far we're well over 70%, right? 80% of them have been vaccinated. So, and there's more still lining up to being vaccinated. So, all we can say is we've done a great job. There's a few out there. We encourage them to come and get vaccinated. And hopefully, eventually, there'll be the vaccine for the 0 to 12. But for now, we just wait. And I think the initial estimates were some early next year, right? Was what I've seen. It could be later.
Potentially, yeah.
Yeah,
It's hard
but
to say.
It's hard to say.
Maldi last question nga kay President mangora ngara kora war da Taiwan to kora Taiwan al gidel tel sterile corridor gida metara kora concern tira te gidel masibling mo niya sera blue law ngaya kora indication wa setamo change sa protocol al gidel at yalo maral me yalo mosto bal ubeng malumol maleng ngara kora processor say
Dengan meran le solo karut, sera gotera bodo dengi mandim le sig del tan ka dogai sera ambasador Taiwan, mulo ai sera Taiwan CEC. Matamal la understand nem la sorin mo dengi detail el wase tirgatam la regel me mil gram. Kada mil stira regel gol information matamne asing imported case. Mandim le sarudera afternoon at tamal gol meno asendia. Di mal mol leng radra Taiwan amal beto imported case til direct. Yang penting lo ase ngidim nguem container ngiem controller ngien you should be okay. Mong kada ngane am lo dosa da se tla mosto balu dia mal mol. Mongile algoritmo mas el morala flight. You'll be okay. Sula.
Mr. Presidente, tira para las la Palau Radio.
Good afternoon. Good afternoon. My name's Irene, and I'm here with Palau Wave, with the SWAL program, which is an open platform for the people of Palau. I'd like to acknowledge the Lady Doctor and Mr. President, Dr. Haley Cash. Thank you, and thank you, Dr. Hancock. Thank you, Kafar, my classmate nga karariter. Maldi, there's tang ay garik. There's tang andi ka atrablu presidenta oldur to ase elak mo nga sularitel no ngils mo diesel contact tracing et ilul dire kal tokor bela mo krahmal mo blakatak dil asel ko ngeru asel gerel tele restriction of movement mesel garira atrablu ase Kadawasang ngarangi, laptop ta press release, immediate release, may kalbato kalbabiel ko muldurok, klar atara kapilment. And the tanggal mal mangkare enforce sa saigang, lang ngarangi tirigel ko rahmal diol tirak na silang ngar matamiw mamatamam. Hindi sila keto di oli taigal, restricted movement. Melang ngarangi atara palu, President yang atira kan mereng asulia la kuk minister mutu le kama makora mong atatu.
Hindi ka rin sel force look mo mereka tapos next.
Mal diungil.
Okay. So kakpa sa tela kafare.
Sulang Irene raw the swal. Man marat to koy so قد مدنيل وسيرا أو إيرا البوريني قال تبلو الجيس يقدم السادة ماسك ديريك اللي ملغ السالب الطغر هذا المير دي قلت ديرك سيجيد اللونيت من الالتايم التريال من الالسيل سانغاريا ميتيجيشن اوردر سنيلاي سيال ساينريا ديريكتور بابليك هيلث المال مغطى كليل وسيجل الغوط اللي يم الكلبسيرا سلمي انجيري المصادرة بيصير ما أمرولير السلا بلو الديمو يجيل نيا أرؤود الجيري ممكن سير هذا الموريور سير المرابانغ سير المرستوان المراغلير سير المرا يجيل شوباي ما باشول نيا certified را أبي أوتي ما PBA سيجيدي
Hindi ka lungil albora school. Hindi ka albora school.
Hindi ka albora school. Hindi kita madangin lo se umusindra ngal kalmea adirga kalunga orus. So hindi ka albora school.
Hindi ka albora kamaldil.
Hindi ka albora igigid lukura muklolo ndi bulwa kamandil may gilesya ma. Anait marget until atungusel day 5 test. Say giti. Sel tokora pulis. Of course hindi ka sabela ministry ra hel tuwa del momangara erul dartil adra. Bekkel seals make sure hindi akal magi direct lo lingit tara adra bulul wase pomol ng sir kamam lomaklat el suguma ada mal qura di akal tirak di akal mukarrew eng sa el mutaw tara la le sige mitigation order aman makatakilo se at sugum ko yi tay gagi del ngat tay gid order and sabi el mutaw tara la mang ngariya process el iblam got makli mar adra Ministry of Justice. El sabi eda lot tutukla adal sugumong muli tay gigidil ngar sa igid mitigation order. Lul democrat testing wal sugum ta dekalo or ring sa mandekal belo larsel day 5 malugin day 1 sa eda lot tutukla la makadol niya tara adra bulu sa takay ngisew o masindra adal me adi adat adal belo sugum ka madang la adam lo sendiri gamlay
Akli.
akli yal sugum hindi takang emot tutuklil mer ka
Mel asay gidal hotline kami wasab edal diregal ngaray kal media malukura atal wasen sab il call ra hotline al sum komestrer atal daklol tirak partial restricted movement teng o sisul tengwan ngaray kay gidal press release.
Jadi lise kafara ngari sel ngeso el dolari ngara DOI madire gal HHS el mo help rigid el rulia sel contact tracing lo ya dengwa mong seguida mara la urior giral so hopefully by end rayer em namo urior sea gol rigid diga danas mega udo gadamo 3.6 million ara sel system de gadamo mo seguida el part of the effort rigid keeping us safe no.
Mal masaurat til ang president til Europa mlamo o patil ay gid den direk de kalbal kula ko kal ngaring yalla et tirgel guktar stal de kalol tirak lel lorurar bebil mo matak.
I see.
Mela ka demor segit el guk restricted movement at poratokora siopay as of Wednesday August 18th. 154 companies in Palau have been pandemic certified safe for you. Masaygit yaw ngil to ko elang nga kama minister mutu all at adu ay kalkit hindi elang selso ko makuk siya at yakal register the member of Palau Chamber of Commerce hindi agibsan madangali and guk yakal sabamil ko rakay nga sew monitor ay gaygit ay encourage certir mo pandemic certified makora dioger tial guk karila at rabululwa sa hikal stoang Tabato kara adal matuturay kal stoang rabita mabitang surang al supercenter ma WCTC ar adalo rer al tato mask kandir adal matutura al selar bebilen de kalo mask emom tokora to orbitara kiaser tangarangaran mal kayo ged etya kara adal mal matingel waseng kang gukta al dir kam larak pamel may alo bang kang guk larigel may meseng kadal am kararingi
ka malungil concern di so adal muktel beringa sulir adal abalu masyobail again dir ka kura mandate to dalo sebom enforce at kura mask ma baby restrictions sebay ditir la akutmok lay multoy ra situation al time adagi multo da mandate hindi na kamaro shobal dingil mesa adal lumdaswing ngirel mutmokra mungarakel sobokli en sabil malukol yalla kalo ultirak en sabil refuse a service again katamre nga sulir adara balu makakulog shobal la detail na tega initiative magada mutal yolngitra aklay nga sew ma support adara balu sa mem da kay nga sew mutmokor segide laldo sa da mask hindi ako tutalala ada mandate tamas kaya ada long mask luwasay malubong wasay it's either you're wearing a mask properly or don't wear it mang segide direct kalo ngitring la sel so makamora sto nga mesa adingi dil adal al okya kamal kasher mangral ko di dargak la tetelalo mask direct kal mo seul reminding lo sitilalo moruring ada kal defeat the purpose of the mask mo ngungil time the practice and God forbid albonia community transmission elba algira man mandate already kada madu am tangal teletal so ang say gid de nitra coloring ra atrabalu ma support ma assistance ra gay gid rogul doru
Dire kali bok tadi lo asing ada training al bolkan tak training August 26 Thursday at 4 o'clock el pandemic safety training Moria Civic Center mga encourage it gid Tukol show ba businesses maybe they can member a chamber please ebo okay 8 a.m. Di mo yes mamura 8 ra tutan mo 4 ra kabsigi so tal sales civic center sulam
Pai pok tulir to ko ramrigel. Thank you so much Kafar.
I see
And for demonstrating also how to wear a mask. That's important because people who are not members of our organizations, we have no say. So since it's not mandatory, then I'm glad to know there will be a training. So the training is going to be this Thursday at the Civic Center. From what time to what time?
8 to 4
From 8 a.m. to 4 p.m. So all businesses who are listening right now, this live conference, whether you're a chamber member or not, please go through that training. So do it for everyone. And it's, of course, free of charge. So that's good. So my last is, actually, I just want to acknowledge Dr. Yanoy, President Kovit. He did a very nice video about chewing betel nut and how to be sanitary, health-wise, hygiene. And I asked him today, earlier, before we started, if there's any possibility that the media could play that again for the public. And I'm saying this in English for the doctors here. I'm sure you've noticed that some of us do chew betel nut. And I'm one of those who's still praying that someday it will not be in our hospitals anymore. So I'm being honest.
I see
Okay, my last question is, what are the side effects of these vaccines? Ngaragal ko koratal manlele, toktang lang ngaringa, ikal rokul kaltola koratil ang ngaringa ko bungaringi, pamsulang.
Adverse reactions. Why don't you,
Yeah, great question. So these vaccines have been given in the U.S. now, that includes Palau's numbers, it's over 169 million people have been given these vaccines. And during this rollout, there's been more monitoring of the rollout of these vaccines than any other vaccine campaign in history. And what we found from this so far is that these vaccines are amazingly safe. But there are side effects, and side effects are expected reactions that some people have when they get the vaccine. And these are reactions or symptoms that the individual can feel as their immune system learns how to fight against that virus by the training that the vaccine is having the immune system do. And so the most common of those are fever, headache, feeling tired, pain at the injection site. And so they find that these symptoms can last for a day, 2 days, for some people very rarely 3 days, but then people feel better and don't have any adverse or long-term consequences of that. And of course, individuals can take like ibuprofen or Tylenol, acetaminophen to help with those symptoms if they do experience it. Not everyone has those symptoms, and if you don't have those symptoms, it doesn't mean your body didn't respond well to the vaccine. It's just some people have it more than others. The things that we're really monitoring for with the vaccines are adverse reactions. So if there are any conditions that occur more frequently in people who are vaccinated that are higher risk. And you guys may have heard that even though these vaccines are extremely safe, they have identified some conditions that can occur extremely rarely, but do seem to occur slightly more frequently in people who are vaccinated than those that aren't. And so one was with Johnson & Johnson, the Janssen vaccine. There was the increased risk of clotting that was identified. That was one of the reasons why you may have heard it was placed on hold while they evaluated it. And upon evaluation, they found that this is extremely rare. They found that some people were at higher risk, so younger women. And so people are more, they asked people to be on the lookout for it, but it's so rare that they felt that the benefit of the vaccine way outweighs any risk. The other ones that you may have heard more recently is myocarditis, which is inflammation of the heart, temporary, that can be associated with the mRNA vaccines, and especially tends to be in individuals or younger individuals when they're vaccinated. Now, this is temporary and has recovered. They're monitoring it, and they'll continue to look at it. But when you look at the risk of Delta virus or Delta variant of the SARS-CoV-2 virus, that infection versus the really small, it's on the order of like tens per million people who have received the vaccine that get it. That when you look at that risk benefit, it's much more beneficial to have the protection of that vaccine than any small risk of that myocarditis. And in fact, they're finding that for individuals that have COVID-19, the actual virus itself, they actually have, it looks like they may have much higher rates of myocarditis than any of the individuals who are vaccinated. So again, when you weigh the risk benefits of a really extremely rare thing that may happen to only a few people from the vaccine versus what COVID-19 can do, the benefits of the vaccines are way outweigh any risk. But we continue to monitor, and just to reemphasize, in the rollout of vaccines, these are some of the safest vaccines. They're tremendously safe and very effective at preventing that severe illness, hospitalization, and death.
Lungil Irene, clear, eh?
Ramla ngala krerul sigang. Ang dasang alam mo sa edel molungul ma Wednesday adan diwile di drutel mal di mrenga sulir arbekla fa tara blada subira ikan meeting era chills sing sedel mo improve ra communication ma io sia active lang magafara mo lao aisra se mo bekal chills lor to dara ukka brief summary so everybody is up to date. Legum daswa will communication aru tira adam to modega tasal ba aklarandire mo ala laklarandire ndekal sal show garandire ingal tegal terur toktang amagya de rule sunday mataman mo naman mitra matira gal ka cross agency ma NEC rak logo legal help make sure a plan ergida mo rather refine the rule man mo address again rule yeah possible album leather future para di mga sulim البول سمريال والتوضع أيس المرابلو يوم ما سوى رجيد التال على لذا لو أيس الأضربلو يجي يقول يا البنغلر وما المسؤولان يا ده صار مقلتات والمال من مقلتات رابلو البلاو مقلتات رجيد يقول وما المسؤولان
هذا لو أيس السيدة مولى بنغلر لا بريس كونفرنس رجيد تال تقوبت بريس كونفرنس رجيد السيلز بقولنا سولي تيال بارتنرز رجيد بقول النور تيان Maria Chorgidra Angel Belau, Lego Paradise FM 87.9, Magombali Gidra PNCC, Magargidra Belau, Michael Ablulav, Madira Kal Palau Media Gansol, Gansistra Private Media Belau, of course tiri partner sir gid ngani TMC television ma PWFM radio ma TV ma dire kaltiavela newspaper ma Island Times newspaper mga sulir bekla de mal invite rogul ade rogul adra medial me lava vivir a cuestión se me mete la bebula tebra Wednesday ni amar el tema la ondi brigid yo mal misaul e di mette gid hoy día colgion mo ngar el velar tel bitam el polo regular program radio adra blue